Hello and welcome back, friends. My name is Michael Yates. This is the Ridgeview Pod. Once again, we're always grateful that you have chosen to spend some time with us. I am delighted to have Zach Lakins with me today. He is the Inpatient Admissions Coordinator, and I have to admit, Zach, I can't believe we've been doing this for a little over a year, and you're the first guest from the inpatient unit.
Wow.
I'm a bit embarrassed
That's
that
all right.
that we've not had you on before now, but your timing is perfect.
Yeah.
So for our viewers, just first introduce yourself and tell us how long you've been with Ridgeview and what your role is.
My name, again, is Zach Lakins. Of course, we've already established that, but I'm a registered nurse and admissions coordinator for Ridgeview Mental Health Center here in Oak Ridge. Been a nurse for 13 years now. I've been on the mental health side for probably about 9 years. Although you do experience the mental health aspect in nursing probably every day in your field. But as far as being the admissions coordinator, what I do here is look at the referrals that come through, the charts that come through from the outlying ERs in Tennessee, basically. Mostly Eastern Tennessee and the greater Knoxville area. But I mean, anywhere from Middle Tennessee, Clarksville, Nashville, all the way down to Chattanooga, and even again West Tennessee and the upper northeast corner of Tennessee. And we look at those referrals and see if the patient meets the Ridgeview inpatient unit criteria. We try to get them in here, and we try to keep this place as full as possible. Easier said than done.
Yeah.
But that's what I do.
All right. Very good. Well, we'll talk a little bit about, what does, I mean, there was a period of time when I served at Vanderbilt Psychiatric Hospital years ago. So this is probably, I don't know, 30 years ago. And the length of stay, and it was an child and adolescent psychiatric hospital in Nashville. And the length of stay was anywhere from 3 to 6 months.
Yeah.
And nowadays, it is real quick, acute care,
Yeah.
and then trying to transition people back out to community quickly.
Yeah, absolutely. A lot of times, patients or people nowadays, they need to come in and get their meds adjusted, or they need to come in in all honesty, they're having a bit of a break, and they need some help reestablishing their place in life and where they're at, and getting back on track. And a 3 to 5 day stay, which is the average here at Ridgeview Mental Health Inpatient Unit, is really a great fit for that, because you can come in and we've got a great psychiatry team here. We've got a great team, and they holistically, therapeutically look at what the patient needs. The nurses are fantastic. The social workers are fantastic. The activity therapists are fantastic. And what this does for the patient to have all these resources when they come in is get all those things taken care of they need within that short period, and get back out to their life.
Well, I love the way you said getting back on track. That is a part of the purpose in an inpatient setting, is to help an individual get back on track. I think that's beautifully said. So I just want to corroborate, I guess, what you're seeing on the unit with what I read about out there in the world. So this is 1 week's worth of newspaper articles that I've collected.
Yeah.
This is from last Friday. 41% of adults report increased symptoms of anxiety and or depression, according to the Kaiser Family Foundation. A quarter of 18 to 24-year-olds have seriously considered suicide. Here's another stat. Tennesseans living with drug addiction are at risk of fentanyl overdose deaths, which rapidly climbed from 1 out of 6 in 2015 to 4 out of 6 in 2020.
Yeah.
In Sunday's paper was this gentleman, his book, Charles Dodd White, A Year Without Months, is basically a memoir of his experience of having lost his father, uncle, and son to suicide. Yeah, I would love to talk with him. Maybe I could have him as a future guest.
Yeah.
But I cannot imagine the pain involved in that.
Absolutely not.
Here's one again from, I think it was the same Sunday, May 15th. Pandemic rise in addiction requires action. National Institute on Alcohol Abuse and Alcoholism increased by 20,000 from 2019 to 2020.
Jeez.
That amounts to a 25% increase in deaths in 1 year.
Wow.
Here's one from May 12th, Thursday. Drug deaths, fentanyl sets record. In 2021, deaths surpassed 100,000 in the second year of the COVID-19 pandemic. On and on and on and on. Today's paper, so we're recording this on Friday, May 20th, in the Oak Ridger is you, Mr. Zach.
Yeah.
There you are.
Myself and the team there.
Yep, you and the mobile crisis team. And this article is some piece of good news, and that is the effort to hasten access to the inpatient care setting. So are you seeing a lot of folks impacted by addiction, dependence, overdose, non-fatal overdose, obviously? Tell me what you're seeing.
Yeah, we do see a lot of people who are impacted by addiction. It seems to rear its ugly head everywhere you go. And not only does it impact these folks on a state of, I've got to have this drug. Your brain's telling you, you're looking for these endorphins, for this high, this addiction every day. But it also helps, it doesn't help. What it does is affects your mental health on a daily basis to do things that, you and I, somebody that doesn't have a drug addiction, we don't have a problem of, getting our kids off to school, remembering to feed the animals, those types of things, getting up and going to work, brushing your teeth, taking a shower, eating, taking care of yourself physically.
Just some of the basics.
Absolutely. And so it continues to rear its ugly head with a lot of our patients that we see. And we do have some, resources to help with that here at Ridgeview. We do. We're not a drug rehab detox facility per se, but we do have some resources, a lot of resources to help with that, to fight the drug rehab. And our social workers, as far as helping these patients that have these addictions and are fighting these battles, they do a fantastic job of trying to help them with follow-up appointments for those things once they're discharged from our inpatient unit. They do a great job of that. If they, if they can. I mean, they will absolutely do whatever it takes and keep the patient as long as they're here to say, hey, listen, we've got you a follow-up appointment, at this rehab or detox facility, because we know that you need it.
Right. Yeah, we've learned in some of the episodes we have talked about the science of addiction, and I think you bring up a great point that folks who become addicted to some of these drugs that have a high level of potency really alters brain chemistry.
Absolutely.
And
Absolutely it does.
a 3 to 5 day treatment stay
Yep.
up in the hospital is not going to fix that.
No, it's not a cure.
Yeah.
It's not a cure. It's an everyday battle. I mean, it is, and that's addiction. Unfortunately, you're drinking your coffee right now.
Yes,
What's
indeed.
coffee got in it?
Oh, that lovely caffeine.
Yeah, caffeine. Caffeine is a drug, right? I don't, fault people for going out and have a cigarette or, chewing tobacco. I grew up around all that stuff, and it's just a part of life. But it's an addiction. It's telling your brain like, hey, like this is good, get some more.
Yeah.
It's the same thing with drugs, and these patients that come here and they have that going on, man, they need our help.
Yeah.
And we should be glad to help them, to fight these battles, because they're here for a reason. They're here because they're saying, hey, like, I'm in trouble
Yeah.
and I need some help.
So let's say I am experiencing a despair beyond despair, and I am on the inpatient unit.
Yeah.
You mentioned a couple things that I could expect. One is I would be connected with a social worker. I would have, you mentioned occupational therapy, or it was some type of group therapy.
Yeah, activity
Activity
Yeah.
therapy. What else? Meeting with the psychiatrist for maybe med management.
Yeah, absolutely.
What else could I expect?
Well, so there's group therapy. Whether it be the social worker or one of the activity therapists, they try to get the patients in with groups and get them involved and participate and ask questions and let's say you got this going on in your life, what would you do in this situation, or what should you do in this situation? And it allows the, and then also the nurses go in, with these group therapies as well, and they ask questions like, hey, like what, feel free to speak up. I'm gonna, I may call on you, I may not.
Yeah.
And if I call on you, I want you to open up and talk. But if you don't feel like it, you don't have to.
Yeah.
If I don't call on you and you want to just speak up and say, hey, this is what I got going on, please feel free to.
Yeah.
This is the time.
Yeah.
It's a group session. We want to get everybody to participate and involved and get everything out there in the open. There's nothing to be embarrassed about. We're here for this reason. You think about AA, AA meetings. I mean, I don't know if you've ever been to one or not, but I've been to one, and, a lot of AA meetings, hey, my name is so-and-so, I'm a, alcoholic, or I'm an addict, and then they tell their story, and it gets that burden off their shoulder, all that, that weight,
Yeah.
So that's kind of the, some of the things that go on in these group sessions and things of that nature. And then I don't know if they
So
see
they
a
know they're not
psychiatrist.
alone.
They're not alone. Yeah,
Yeah.
they're not alone. And then you've got the other staff there, like the psychiatry team between, Dr. Batasia, and we've got two fantastic nurse practitioners, psychiatric nurse practitioners right now, and Mara Cavaservice and Angela Whitworth. They're just fantastic. They get the patients, alone on a one-on-one session, talk about what's going on. Hey, how have you been doing on the unit? Listen to them.
Yeah.
Listen to their thoughts, where they're at still. Is it a improvement? Is it a regression?
Yeah.
Is it kind of like a complacent area? Where can we go from here? That type of thing. What do you think?
Yeah.
This is what I think and my expertise. That type of ordeal. And then another great thing about our unit is you can actually go outside without leaving the building,
Yeah.
and get some fresh air.
Yeah.
You can't take a smoke break or anything, but we got nicotine patches for
Yeah.
that. We got good food.
Yeah. Well, what I liked about what you said though was the opportunities to share their story with
Yeah.
either individuals or groups. And,
Yeah.
what's come up a lot in this, our podcasting has been this concept of Brene Brown, where if you can share your story with someone who will listen with empathy and understanding, shame will not survive. And part of helping people get back on track
Yeah.
is that process. As you mentioned, it's not uncommon for folks to periodically come back into needing hospitalization. It would be entirely possible that a lot of folks might end up feeling badly about doing that. And we don't want that to happen. It's supposed to, this is an opportunity to get back on track. And treatment planning is part of that.
Yep.
Working out a plan for discharge where you're connected to the community resources that keep you on track for recovery and better mental health optimization all around. So, well, I know a future episode we're going to have one of the members of the mobile crisis team. I know we're trying to, I'll put in the links to this episode, an article that talks about our process to try to hasten admissions, because what we don't want is folks, waiting not just hours, but days in an emergency department waiting for admission to the hospital.
That's a big deal right now.
If they're in emotional pain, we want them to get admitted as quickly as possible. So stay tuned for that. We're recording this in May. It is National Mental Health Awareness Month. So I'm always curious with our guests how they are good stewards of their own mental health. So what do you do to take care of yourself?
Oh, man. Well, I try and pray when I remember I can. Spirituality is a big ordeal. Family, is a big ordeal to me. Just remembering, like, hey, I've got people out there that are counting on me, and it kind of gives me that extra go. But in all honesty, probably, I don't know. I was young whenever I seen Maslow's hierarchy of needs. I was really young, and I thought, oh wow, what's this? And started looking at that, and it's such a simple, basic breakdown and outlook on how to take care of yourself just in life. And I'm like, well, I already know these things, but I'm sitting there looking at it, and it's drawn out, in a little pyramid, and it's kind of like, well, this guy was pretty smart, wasn't he? So, it's obviously published, and it's all over the world. So it's like, it's true. You've got to start from the ground in your physiological needs, and go all the way up. And that's just kind of how I view life, man. Prayer and family.
Got that shelter, food, clothing.
Yeah, that's it, man.
That's
it. It's very important, and there's so many of our patients that they don't have that.
Yeah.
And if they can come here and we can get them, on that track of like, hey, first and foremost, you got to take care of these basic needs. Yeah. And then let's start thinking about those things that you want in life.
Right.
And kind of where you want to be.
Yeah.
Yeah.
All right, good. We also try to have a little bit of fun on here and not make everything all clinical.
Yeah.
So if you'll indulge me, I've got a few questions for you.
Will do.
I always have to give the admission that I got this idea from Greg Bennett, who's a podcaster, a triathlete podcaster that I follow, and he asks some of these questions of his guests, and it always gives a little insight and fun. And for our listeners, it gives them something to think about for their own, how they would answer. So Who's your favorite superhero and why?
It's got to be Iron Man.
Oh, yeah.
Yeah. He's just a smart guy, obviously, to have all those resources in his hand. And, he can fly and he's got guns and
It's a cool suit.
come on, man.
It's a cool suit.
He's got the house, he's got the cars,
I like it.
Yeah.
I like it.
Yeah.
Well, in keeping with that, if a movie was made of your life, what genre would it be and who would play you?
Man, that's a great one. Jeez, man. Oh, there's so many movies out there.
Yes,
Man.
it is.
I worked at the theater for like 2.5 years. So
Oh, wow.
I consider myself a bit of a movie buff.
Well, to give you a little, I asked this of Marcus, who was a previous episode.
Yeah.
And he said it'd have to be a movie that's so vexing it leaves you wondering what just happened. And I said,
Yeah.
so you're talking like a movie like Tenet? So I don't know if you've seen that, but it leaves you going, what did I just watch?
Yeah. I don't know. Happy Gilmore.
Okay. All right.
Yeah,
I like it.
yeah.
I like it. So would it be Adam Sandler's playing?
Yeah.
Anything to like give Bob Barker a good
Oh, yeah. Yeah. Take that, Bobby.
right.
Price is wrong.
All right. What is the best decade of music?
Oh, I mean, to me, it's got to be the 70s, man.
Huh.
It's got to be the 70s.
So give me a band or two that.
I mean, Fleetwood Mac. There's so much going on in the 70s as far as music wise.
Yep.
Fleetwood Mac and Kiss, and then you got like, a lot of disco and like Donna Summers, wasn't she in the 70s? Yeah. And then, just a bunch of funk in there as well. Just a lot of different eclectic stuff going on.
Yeah.
Hard rock and classical rock and soft rock, Bee Gees and,
Zeppelin, Stones, The Who.
The Stone, exactly. Yeah, Zeppelin for sure, man. Absolutely. Yeah, that's got to be the best. I mean, era of music.
Yeah.
There's so much eclecticity there, if that's a word.
Yeah.
That's got to be the
We're
best.
making it one.
Yeah, that's got to be it, man. There's just so much there. It's hard to name them all.
My cousin would love you. He's a big Kiss fan, and the fact that you mentioned Kiss.
Oh man, I seen those guys with Aerosmith in TBA in high school, and they were on first. Kiss came on first.
Wow.
And they we stood up the entire time, and by the time Aerosmith got on, we were sitting down, and Steven Tyler was getting mad at the crowd because everybody's sitting down.
You gave
we were
all
wore
the
out.
Kiss.
It all went to Kiss, man. I didn't know that Kiss was going to put on that kind of a show. They were awesome.
That's awesome.
Yeah.
Great. All right, just a couple more here. If you could invite 3 people to dinner, living or dead, but not family, who would they be?
Jeez. Teddy Roosevelt.
Oh. For what he did with the parks and
Everything.
all that.
Everything. Okay. Rough Rider, those type of stories. Absolutely, to pick his brain about wildlife conservation and land conservation. Absolutely. And just the bully, all that, man.
Really epitomizes the American spirit.
Oh, man. Yeah, absolutely. So he's up there. Probably Abe Lincoln.
Okay.
Yeah, gotta get Abe in there. So we're sticking with the presidents here. And then I don't know. I'll stick with someone who's gone on and say Edison.
Okay.
Yeah. Yeah, Thomas Edison.
Thomas Edison.
Yeah.
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 All right.
That was
Nice.
this guy that invented a few things.
Well, you mentioned a couple presidents that are on Mount Rushmore. If there were to be an additional person placed on Mount Rushmore, it doesn't have to be a president, but who would you make that additional face to Mount Rushmore?
Wow. You know, that's a great question.
Iron Man.
Oh man. I don't, that's a fantastic question, man. I'm really, digging for somebody here that's really came out with something that's, kind of life changing for the better. But, I tell you what, man, I'm gonna be a sweet son here. I'm gonna say my mom.
Oh, nice.
Yeah.
All right, Mom.
Yeah.
You hear that?
Yeah.
Yeah. Okay. Well, you got big brownie points there.
Yeah.
You're a wise son.
Yeah.
Right there. Wise son. All right. Two more. Your dream vacation.
Oh, easy. Bora Bora.
Oh, wow.
Yeah.
All right. You didn't hesitate on that.
No, my wife asked me about where we're going for our honeymoon, and she said anywhere. And she just put her stuff down she was doing and closed the laptop. She's like, "Hey, I'm serious. Where you want to go on our honeymoon?" I was like, "Trust me, you don't want to know." And she said, "I'm serious." I said, "Bora Bora." And she's like, "Is that a place?"
So you have been there?
No.
Oh,
No.
okay.
No, we
okay.
didn't go. No.
Okay.
No, we
But that you want to go
Yeah,
there.
man,
All
that
right.
would
All right.
be. I mean, have you seen that water? Holy
yeah,
smokes,
yeah,
man!
yeah.
Jeez.
Yeah.
So
I just came back from Destin where the water, they call it the Emerald Coast. And I mean, when the water is calm, certainly in May, like it is now, I mean, you can see not feet, but yards underwater.
Absolutely.
It's really cool.
yeah.
All right. Last one. What is the thing you're most afraid of?
Probably leaving this world in worse shape, and than when I was on it, and not trying to do better for it and leave it in better shape. That's one of my biggest fears.
Wow.
You know,
That's
I-
a heavy one right there.
Yeah, I got two little boys, so that's I need to teach them, like, hey, be a good person.
Yeah.
That's be a good person and treat people with some compassion and stop and smell the roses and be a good person
All right.
and treat everybody like they're a good person.
Well, I cannot imagine a finer note to end on than that right there. There's a life lesson for all of us. Zach, I hope you come back. Next time we need to talk football.
Yeah, watch out for the sleepers this year, 2022.
All right. Well, it's been a pleasure to have you. I've learned a lot about what takes place on the IPU and the mission it serves in meeting the needs of people who are going through very difficult times in their life and helping them get back on track to better optimize their own mental health and reclaim their life and live a life of recovery. So thank you for coming in.
Thanks for having me.
I hope you've learned a lot. Thank you for tuning in. Don't forget to subscribe, ring the bell so that you get notification of our each episode that's published. Take good care of yourself, and we'll see you next time. Bye-bye.